Hello and welcome to the Product Relay, part of the Wound Care Advantage Winter Games. Today's session is brought to you by Nuo Therapeutics and presented by Dave Hazard. Please ask any questions that you have throughout the presentation by using the questions or chat tab on the control panel. I'm now going to hand it over to Dave.
Thanks for the introduction, Kaylee. And yes, please let this be interactive. Happy to answer any questions that come up as we're going through this. But we are very excited to partner with Wound Care Advantage on their Winter Games product relay. We went through their formulary process, and this is, I would argue, one of the best formulary processes I've ever seen. A lot of questions were asked around the product and reimbursement and FDA approvals and all that were in depth. So very excited to be partnered with Wound Care Advantage, and we're going to talk today about the Aurix wound care gel product. So just a quick agenda. We're going to go over the product itself. We're going to talk about the preparation of the Aurix product. We're going to talk a little bit about the clinical data and cases, and then how we typically roll out and support Aurix in your centers. So what is Aurix? Aurix is a wound care innovation. The autologous biodynamic hematogel is a fancy name for a PRP gel. So we are a safe, rapid, point of care product that is all inclusive. Everything you need to do the procedure is in our kit. We have an extremely broad FDA clearance for all exuding wounds. Our reimbursement is more narrowed to diabetics with chronic wounds, and we'll talk about that a little bit more in length here in a minute. So if you remember nothing else from this presentation, this is the slide to screenshot. But why is Aurix such an advantaged treatment in the wound care centers today? Well, there's a few reasons. The first is our preparation time is an average of 6 minutes. The only way we see variability in the prep time is on the blood draw. So the kit itself takes about 4 minutes to prepare. The blood draw is usually anywhere from 2 to 4 minutes. We do have the simplest blood draw in the market. We vacuum charge our monovets at the time of use. We can do a minimum of 5 milliliters of blood. 5 milliliters will treat most DFU-sized wounds. And we have ACDA in our kits, which means from the time of blood draw, you have over 4 hours before you have to use the product. Also, we are unlimited sizing. So MUEs are not a factor with this product, and we have no minimum sizing requirements the way you see with skin subs and things like that sometimes. Our reimbursement is fantastic. We have a national coverage decision. We are high bucket APC 5054, and we typically, under the NCD, are allowed 20 applications for 20 weeks. Also, and I'll talk about this a little bit more in depth, the 11042 debridement is allowed with this G code, which is a unique advantage. We also have tons of data. We have a level 1 CMS sanctioned study. We have randomized controlled trials. We have peer-reviewed studies, all kinds of data. When it comes to data, nobody's going to be able to touch this product. And the last is our handling characteristics are second to none. The product can be a liquid, flowable. It can be a gel, it can be a clot, determining on the wound shape, size, or any other characteristics like tunnels, undermining fistulas. So that is why Aurix is an advantage product. I'm going to walk you through in depth a little bit more on each of those topics. So just a quick overview of who we are. Our company is called Nuo Therapeutics. We used to be Cytomedics. I'm not going to spend a bunch of time on this other than to say we were the first company to ever get a wound care indication for PRP. We did that in 2007, and in 2012 we entered into our level 1 study with CMS. And after 7 long years and a lot of money, we were able to turn that in and get a national coverage decision from CMS. So Cytomedics is no stranger to PRP. They actually hold the original patent on PRP in the US, the Knighton patent. They developed the Angel system and sold it to Arthrex. They are the first company to ever get a wound care indication, and They're the first company to ever get pharmaceutical reagents included with PRP. So a lot of firsts around Nuo Therapeutics, and we know PRP arguably better than anybody else in the market. So the Aurix product, as I mentioned, is extremely proven out by clinical data. We can heal any wound at any stage. Non-healing stalled wounds respond extremely well to Aurix, and we have a study that shows that 97% of patients that were stalled an average of 330 days saw a 50% size reduction in 2 weeks or 2 treatments, so about 14 days. We have a significant time to heal advantage on people that smoke, who have peripheral artery disease or obesity. And in our level 1 study, it was an all-comer study. So we had a lot of exposed tendon and bone, Wagner grade 3 and 4 wounds. We had all the patients with those comorbidities above. And this is a real world wound care center patient population. And what we showed is Aurix healed wounds at about an 81% 12-week healing rate versus 43% in standard of care. And that included skin subs, HBO, and wound vacs. So almost twice the healing rate when you include those patients that are usually excluded in studies. And this can all be sent out, but we just have all kinds of data around this product. This product is very supported by data. So the components of the Aurix system are, there's 3 parts. The first is the centrifuge, and you can see in the bottom of that square, you can palm this thing. It's 4.3 pounds. It's 7 inches across, and it spins PRP in 1 minute. It's the fastest centrifuge on the market. It's actually 52 seconds. But from a size perspective, it does not take up a whole clinic countertop. It's made to spin on a Mayo stand, and it's extremely fast and simple. There's a start and a stop button, that's it. The middle square is our actual Aurix kit. You have everything needed for the blood draw, the phlebotomy, and then we have everything needed to mix in the reagents with the PRP. And then the last square is our reagent kit, and I'm going to talk a little bit more in depth on that. We have 3 things in this kit. The calcium chloride and the thrombin are there essentially to facilitate the clotting cascade. They begin the clotting process. They also activate platelets and do some other things, but generally they're there to make the Aurix product gel. The ascorbic acid is a little bit more important. That's the secret to our sauce. We did early in Cytomedics' life. They got data from a scientific company that did 25,000 patients worth of treatment with PRP. And what they found is all 25,000 of those patients were deficient in vitamin C. And there's several reasons for this. The first being that these patients typically have very poor perfusion. So no matter how much oral vitamin C or IV drip vitamin C you gave them, they did not perfuse down to the wound. The other reason is inflammation depletes vitamin C, and these chronic wounds are chronically inflamed. So vitamin C is an extremely important and necessary component to collagen production. When vitamin C is present, you get collagen cross-linking, and you end up with type 1 collagen or native tissue collagen. When vitamin C is not present, you get that type 3 collagen, which is scar tissue. So you'll see with other wound healing products out there that you often will see a scarred healing, and those wounds can reopen. Our wounds don't reopen very often, and they also have that type 1 native tissue right where we put the product. So that's just a quick overview of our reagents, and that's why this product is somewhat special. So how do we do this process? It's a 4-step process. We draw the blood, we spin it, we mix it, and then we apply it. And again, just to have some illustration around those 4 steps, we draw the blood. That takes usually anywhere from 2 to 4 minutes. We spin it. That takes 1 minute. We mix in the reagents. That takes anywhere from 1 to 2 minutes, depending on how many times you've done it. And then we apply it. And the first 3 steps in this can be done by an MA or a nurse. And this can be done up to 4 hours from the time of blood draw before the product is applied. That last step, the provider would do their debridement. and then we would apply the product once the calcium chloride and thrombin are added. And typically the product is liquid for the first 45 seconds up to a minute and a half, and then it starts to gel. So while it's a liquid, like in the picture on the left, we can run it into sinus tracts, undermining, fistulas, tunnels, any abnormally shaped wound. And those will heal typically in 1 to 2 treatments, depending on severity, right? If it's very severe, it might take a little bit longer, but they heal very quickly. And then once it does actually start to gel, you can see in the middle 2 pictures there, we then frost the wound or coat the wound. I know frosting is kind of a gross analogy when we're talking wounds, but we want about a 1 millimeter thick topical coating on that wound. We don't want to fill the wound, we'll get maceration. We just want to coat it. That's one of the reasons this product can go up to 2,000 square centimeters per kit. We're unsized because we're just coating the wound, we're not filling it. And then if you're working with an inverted wound on a heel or something like that, we can clot this product all the way to a full clot, put it onto the included interface dressing, and then put it up into the wound. The interface dressing is included in this kit. It's essentially an adaptic without the petroleum-based Vaseline on it. We cut that to size, lay it right on top of the PRP, and then from there, we typically recommend some sort of vapor barrier for a primary dressing, like a Tegaderm. And if you're worried about exudate, fenestrate that Tegaderm and put an ABD or some absorbent dressing on top of that. This does down-regulate exudate, so you should see less exudate when you use the Aurix product. So who are the ideal patients for this? Wounds that have exposed tendon and bone. We do very well on those. You'll see granulated tissue over that exposed tendon or bone typically after 1 to 2 treatments. Also exposed hardware. We do see that first MTP, we see trauma cases. This product works fantastic over exposed hardware. Any wound that has undermining sinus tracts, fistulas, or tunnels. Surgical dehiscence, this works fantastic on. This one's interesting. So wounds that are indicated for negative pressure. One of the reasons we are a great replacement or a great adjunct to negative pressure is this. We can treat any size wound and we get 20 treatments for 20 weeks. So we typically see a massive reduction in size. So the negative pressure is not necessarily needed anymore to reduce the size of the wound. It still can be used for exudate management, but other than that, we are somewhat of an obsoleter of that technology, which is exciting. And then anybody that's stalled, non-healed, or difficult to manage, Aurix is a fantastic option for them. So contraindications, we want to stay away from patients that have bovine allergies. It's very rare, but if they have a bovine allergy, we do not want to put the thrombin in the product. That is a bovine-derived thrombin, which is a very common type of thrombin. But we will use it as a liquid instead of a gel. Also, patients that have active malignancies, active cancer, we want to stay away from. And then patients with extremely low platelet counts, end-stage renal failure, we want to stay away from those patients. And then the last is patients with a clinically diagnosed infection. We want to get that infection under control before we use the Aurix product. Some other things to be aware of, we want to avoid silver dressings because those are cytotoxic. This is a living graft. Chemical debridements or chemical infection control, you can use those. We just want to rinse those thoroughly. And then absorbent dressings right on top of Aurix. We want that vapor barrier in between because those absorbent dressings will draw up the Aurix product. So I talked a little bit about this earlier, but the FDA clearance and indication for the Aurix product is all exuding wounds. So we are on label for anything that exudes. You're talking not just DFUs, pressure ulcers, things like that, but a surgical incision, a surgical wound would be a on-label use of this, as well as any other things. So our indication is extremely broad, but our reimbursement, as you're going to see here, is more narrowed. So we received a national coverage decision in 2021, and those of you familiar with the benefits of an NCD will realize why that was so important for us, but an NCD gives us not only nationwide Medicare coverage without MAC intervention, but it also gives us Medicare Advantage coverage as if it's Medicare. So Medicare Advantage must cover it at the same rate, same quality as Medicare, including not doing prior auths. So they may still ask for prior auths, but you do not need to do prior auths with Medicare Advantage. So we have multiple EOBs showing this to be the truth, and WellMed, these Medicare Advantage plans like that do cover this product. Our NCD authorizes 20 treatments for 20 weeks, no limitation on sizing, and in the point of service 22 and 19, we do see that high bucket reimbursement. I think the national average right now is about $1,739. Our kit cost is $800, and I can treat any size wound with that, so there's no variability in cost. So the code that is covered under the NCD is the G0465 code. Again, the facility fee is, it's actually been updated now to $1,739 from this slide. And then the pro fee is left up to the MAC. So we see an average generally of 120 up to 190 per treatment. But this G0465 code is an interesting code, and I'll talk a little bit more about this in a second. But there is another code associated with this product, and that's the G0460 code. That is not under the NCD, but it is for non-diabetics that have chronic wounds. So that would be your pressure ulcers and things like that. So for now, not covered under the NCD, those would have to be run through the local MACs, but it is a code that is tied to this product. So one other really interesting thing about this G0465 code is debridement can be billed with this, unlike the skin subs. Kathleen Sham, who many of you may know, published this in today's wound clinic. Essentially, the NCCI PTP edit does not exist for G0465 and the 11042 debridement codes. Multiple reduction does apply, so you will see that 100% payment on the G0465, but you likely will see a 50% reduction on the 11042. So just to be clear, this is something that is her opinion, and we have seen it to be true in the EOBs, but it is a major advantage that we have over some of the other therapies on the market. So just to really run this point home, our NCD in the point of service is 19 and 22, that's the hospital outpatient wound care centers, guarantees 20 treatments for 20 weeks and high bucket reimbursement. One other quick note, in the operating room, Aurix is not covered, just like skin subs are not covered. However, we do have a non-reimbursing kit that's in the $450 range that covers almost any size wound and is far less expensive than amnion. So it is a great low-cost option in the hospitals, especially in the OR space. Just some other reimbursement pearls that you should be aware of. So as I've said several times, Aurix is not sized. We can do any size wound. We do have an MUE associated with this code, and that MUE is 1, meaning you can use 1 kit. So you really want to be careful when you're using these products to use a product that has unlimited sizing, because you can only do 1 before you're denied. So if you have a small patch or a small clot, you can't do more than 1 or you'll receive a denial. Also, we don't have minimum sizing, which is fantastic. So you can start treatment on or go to closure on wounds that are 1 by 1 or smaller. Another thing to be aware of is Aurix is a therapy. It's a medical device. It is not a tissue. Aurix is also an adjunct therapy. This can be used in an adjunct to other therapies. So if you finish your 10th treatment of your skin subs, this can be started the next day for 20 treatments, 20 weeks. Conversely, you can start with this, do up to 20 treatments for 20 weeks, and then the next day start your skin sub at 10 treatments, 12 weeks. So pretty interesting code with the G0465. We have no CTP codes. The provider would also build the G0465. It's a HCPCS level 2 code. And then the last, as I already said, this NCD contains the APC 5054, which is the high bucket national average of 1739. We have offered to our customers at no additional charge a reimbursement hub. We have online submittals or fax submittals through this hub. We do benefit verifications, prior auths, IVRs, and appeals with PRIA. So obviously, we're more than happy to set you up with this. They do a very good job on the G code. So some clinical data around the Aurix product.
Sorry to interrupt you. Yeah. Questions come in on those last couple of slides. Okay. The first one is, it asks, is there an LCD guideline?
So the NCD supersedes the LCDs. So the NCD is the thing that we should be paying attention to there. The LCD only comes into play if you're going over 20 weeks, or if you're doing the G0460 code. So the NCD supersedes the LCD, so the NCD is what we pay attention to. Great question, though.
And then the second question asks, can a patient do HBO and have Aurix applied the same day?
Yes.
Perfect. Thank you so much.
Great questions. Yeah, thank you. So what should we expect to see when we apply the Aurix product based on all the things I've been telling you and what our studies show? We should expect to see about a 50% reduction in wound area, volume, tunneling within 2 treatments or 2 weeks. Now, typically what you will see is that wound will shallow out very quickly and then start closing in from the sides. The other thing you should expect to see is most of our wounds heal in 6 to 8 weeks. Now, this is based on our level 1 all-comers study. What we typically see is smaller DFUs will heal in 4 to 6 weeks. Larger wounds can take more in that 6 to 8 week range. So I'm going to show you a couple pictures here. I think these are convincing. The first few are the ones I have personally seen, and then the rest I'm going to show you are from some of our studies. But this patient was treated a couple months ago and was stalled for 18 weeks. They had tried skin subs on this patient, and the picture on the left is pre-treatment. The picture on the right is 7 days after the first Aurix treatment, so 1 week later. This patient had a dehiscence after an amputation that was present for about 3 months. The picture on the bottom there is 6 days after the first Aurix treatment. This patient was stalled. The provider didn't tell me how long it was stalled for, so we didn't include that in the slide. But on the left there was pre-treatment. The middle picture was 6 days after the first treatment, and this was this provider's first application. And they put one of the things that can happen a lot is you put too much on because you think more is better with this product. And so we got a little bit of maceration in that middle picture. And then that third picture was another 7 days after the first application. So a total of actually about 13 days instead of 14 days there. But you can see how quickly that started to heal. And that one quick comment is you're always going to have extra of this product. You can throw it away, or you can use it on other wounds on that patient. You just can't bill for them if it's not the same treatment. This is one of the more exciting treatments we did. This patient had, that was actually the uncle of one of our reps, and they had this wound for 2 years and 2 months on the back of their calf. And you can see the progression there. After about 5 weeks, this patient saw radical healing and closure. And this patient had had HBO and skin subs with almost no effect on the wound at all. And then here's some of the pictures from our studies. This patient came in March 5th with large undermining, almost 5 centimeters of undermining. And by April 18th, we had healed the undermining and closed the wound. So very exciting when you're looking at that extent of undermining. This older patient had an abdominal surgical dehiscence, and after 2 treatments, we saw about a 67% volume reduction, and she was discharged where she continued to heal. This 36-year-old had massive undermining, 4.7 centimeters in some areas, and after 3 treatments, so that's 3 weeks, we saw a 73% reduction in volume and a 45% reduction in undermining. And we have hundreds of pictures like this. This patient was a little bit abnormal in that we saw about a 20% reduction after 3 weeks, meaning the reduction was a little slower than we typically see. But this wound had been present for over 2 years, and the providers were very excited just to see it start moving. This is what I was talking about with the native tissue, the type 1 collagen. So you can see this exposed tendon here. When we look at that tendon tissue, it doesn't mean the tendon is now viable, but it does mean that we're seeing tendon tissue where there should be tendon tissue. So one of the things the vitamin C does is helps regrow the type of tissue that's supposed to be there when it's present. This patient, again, 3 weeks, 3 treatments later, 64% reduction in volume. But you also look at that tissue and you see bright red, healthy tissue starting to form around the sides of that wound. And then these are the wounds that, you know, are the toughest, right? These large sacral ulcers, exposed bone. This was after 3 treatments, so 3 weeks. We saw a 57% reduction in undermining and about a 13% reduction in volume. These are the patients, you know, again, when we're talking giant wounds like this, that 20 treatments gives you a lot of flexibility. You can get that wound extremely small, if not heal it with 20 weeks. And then one of the really interesting things about PRP, especially when you have vitamin C in it, is PRP promotes angiogenesis, you know, vessel formation. So you can see this is after 1 treatment. We did an angiogram on a patient, and we showed that the vessels are growing around the area of treatment. And anecdotally, we've had several of our customers call us and say, hey, you know, I did 5 treatments or 6 treatments on a patient, and they're starting to feel this pain in their foot, and did we do something wrong? And we'll review the process and how they're doing it. And then the question I always ask is, well, did this patient have neuropathy at the time of initial treatment? And it kind of dawns on everybody that, oh my gosh, we're seeing nerve regrowth as well as angiogenesis. So just some cool things that PRP does that other products don't always do. So as far as rolling out to you and your teams, we're committed to service, and the centrifuges and kits are going to be shipped directly to you. Ourselves at Nuo and then our local distribution partners will do the hands-on in-services with you and your staff in person. We have all kinds of resources online, virtual training, step-by-step videos, and then we'll have clinical specialists there for the first several treatments. Really, until you tell us to scram, we'll be there for the treatments. And usually it takes about 2 to 3 treatments before you feel very comfortable with it, and then you have us come in when you need us. So the assets that we have for you are, again, those multiple step-by-step videos, which are very clear on how to do the process. We have a really nice QR code that's on the back of the centrifuge. You can scan it, and it takes you to an IFU that's step-by-step. So if we're not there and you need a step-by-step guide, it's on the centrifuge. We do have that reimbursement hub that I mentioned. We have a really, really good sample procedure note that I really recommend using. That was written by Dr. Carolyn Fife. And that, again, walks through exactly that this is the product that is reimbursed. We have sample 1500 UB04 forms. We have a really robust reimbursement guide that I recommend following closely. And then we have pre-treatment protocols and SOPs. The assets that we have for your patients, we have a really nice patient animated explainer video that walks through what Aurix is and what it does for wounds. And then we have patient brochures in English and Spanish. And if you need other languages, let us know and we'll work on getting those to you. So I threw a lot of stuff at y'all very quickly. What questions do you have for me, if there are any?
Yes, we have one right now, and it's in regards to laboratory. Our patients that are on blood thinners have any concerns with the mixology of creating the gel?
Yeah, so a lot of our patients are on blood thinners. Typically the only thing that we see is a slowdown in the gelling. So that bovine thrombin is, you know, it's the extreme dose, meaning it will clot anything as long as the ratios are correct, and we have all the ratios listed out for you. But instead of 45 seconds, it might be up to 1.5 minutes for somebody on heavy blood thinners. So yes, we do patients with blood thinners all the time, and we are almost always able to clot those patients.
Great. Anybody else has any additional questions? Please add them now and so we can get them answered. Okay, we did have one come in about patient education. Do you know the literacy level that is provided in the brochures?
Let me see if I understand your question. When you say literacy level, what do you mean?
Like probably grade, what grade the brochure is written in for reading levels. Is it a 5th grade, 6th grade, above?
It's extremely non-clinical. It's written for consumers that aren't going to necessarily understand medical lingo. So it's written to be very easily understood by patients. And we've not had any questions or complaints on that yet, which tells me it's probably acceptable.
Great. I'm sure that
if there's concerns, we can always change these things. So this is where we ask for guidance, but we've not had that issue. I think early high school level is what I've been told.
Okay, awesome. All right, everyone, get your questions in. If you happen to have a question after this webinar, please shoot them over to myself and I'll make sure Dave gets them and he can follow up with you. We'll give some last remaining moments to get those questions in. All right, quiet crowd this morning. All right, I would like to thank all of our attendees for joining today's session of the Product Relay, and a big thanks to Dave Hazard for putting on this presentation and participating in the Winter Wound Care Games. Again, any follow-up questions, please give them to me and I'll get them over to Dave. This session will be available on demand once the recording has been uploaded to Louisville University. There is an exit survey there which allows you to put in any questions as well. Again, big thanks to everyone participating. This will conclude our webinar.
Thanks for having me. Bye.